brain health disorders are very impactful to economies at large, and then also obviously to individuals, to families, to, cities and things like that. Brain health disorders, to start with, are disorders across really mental health and neurological conditions, and also across the lifespan. So it's a very large group of disorders. And essentially the best data that we have on the economic burden of brain health disorders right now comes from the IHME's Brain Health Atlas, which is a brand new tool which is looking at globally, country by country, the incidence and prevalence of brain health disorders. It's also looking at the economic burden. And so I think, that there's a whole field of economics that looks at this, but the broad brushstrokes is that brain health conditions impact people's productivity at work. It impacts people's ability to contribute to what's called social production, like volunteering and caregiving and things that are unpaid in society, parenting, things like that. And so if you gross these things up at a large scale, they're very, very impactful to an economy, in the order of in Europe, in the vicinity of hundreds, like $300 billion a year kind of ballpark, and around the world it's like trillions of dollars every year. So this is very, very serious, and so it's good to look at the economic burden of brain health disorders, because it makes politicians and policy strategists and policymakers really stand up and pay attention and recognize that you've got to take this stuff seriously. So that's part of my philosophy is really trying to think about these large scale burdens and then drive large scale change.